The European Union's drug regulator approved the use of Pfizer-BioNTech's COVID-19 vaccine for children between the ages of 5 and 11 on Thursday. The green light comes as Europe is again the epicenter of the pandemic, accounting for about half of cases and deaths. Inoculating teenagers and children could be a critical step towards taming the global health crisis. In Germany and the Netherlands, kids now account for the majority of cases. The European Medicines Agency, or EMA, recommended that children should be given the injection in 2 10-microgram doses, 3 weeks apart. Adult doses are 30 micrograms. However, countries will not be able to start rolling out shots for younger children until next month. According to a spokesperson for BioNTech, the first of the low-dose pediatric version will be delivered on December 20th. While final approval is up to the European Commission, it typically follows EMA recommendations. An EU source told Reuters that a decision would likely come on Friday. The bloc joins a growing number of countries, including United States, Canada, Israel, China, and Saudi Arabia, to clear vaccines for children in the 5 to 11-year age group and younger.
And then on the really high-risk and vulnerable groups.
The World Health Organization said on Wednesday that as children and adolescents are at lower risk of severe COVID-19, countries should prioritize adults and sharing doses with the COVAX program, which supplies vaccine for the world's poorest countries.
I was very, very excited. It was like a dream come true. Yesterday was really a big victory for my family and I. I don't think without that video we would have had any arrests, nevertheless a trial.
Count 2, felony murder. We, the jury, find the defendant, Travis McMichael, guilty.
I thought it was very important to keep Ahmaud's name alive simply because we went 74 days without an arrest. I mean, we went like 2 weeks without anybody knowing about what happened to Ahmaud on that Sunday afternoon. So from that point on, I knew that we had to keep it in the light of things to get some justice for Ahmaud.
You know him as Ahmaud. I know him as Quez. Yes. He will now rest in peace.
Yes. Amen. I would like people to think of Ahmaud's name as change, because Ahmaud has impacted changes in Georgia already with the citizens arrest law. He also was the reason why they repealed they implemented the hate crime law here in Georgia. So I'm hoping that when they hear the name Ahmaud Arbery, it will prompt them to think about change. I hope the guilty verdict in Ahmaud's case will give the families that have gotten no justice at this point some sense of encouragement that if you keep pushing, you keep fighting, that justice will prevail.
Earlier today, the South African government held a press conference and they talked about a new variant that they have found called B11529. I've been updated on this variant by the UK Health Security Agency, and they have now designated it as a variant under investigation. The early indications we have of this variant is that it may be more transmissible than the Delta variant, and the vaccines that we currently have may be less effective against it. So what we will be doing is from midday tomorrow, we will be suspending all flights from 6 Southern African countries, and we will adding those countries to the travel red list. Those countries are South Africa, Namibia, Lesotho, Eswatini, and Zimbabwe, and Botswana. Our scientists are deeply concerned about this variant. I'm concerned, of course, and that's one of the reasons we've taken this action today.
Airports are back in the swing of things this holiday weekend, with more people than last year traveling for turkey dinners. TSA officers screened more than 2.3 million people on Wednesday, representing 88% of the volume screened on the same day in 2019. In fact, Wednesday marked one of the busiest air travel days since before the health crisis. Rising COVID-19 vaccination rates have made people more confident about travel, leading to a surge in bookings. And data showed U.S. carriers ramped up capacity. At Oakland's airport, Jay Sellen said she wouldn't dare miss her family gathering this year.
You can FaceTime people and you can do this, but just spending time and sitting around and having conversations are, to quote, is priceless.
Travelers had to pack their patience ahead of the long lines. But one major difference was noted this year. The work-from-home trend allowed many more people to hit the road, rail, and air days earlier to avoid the Thanksgiving Eve rush. The same may help on Sunday, when return trips are expected to make that one of the most busiest travel days all year.
Americans got their COVID-19 booster shots at a near-record pace in the lead-up to the Thanksgiving holiday after the Biden administration expanded eligibility last week. Just over 6 million people got an additional dose of one of the 3 approved COVID-19 vaccines last week. Data from the Centers for Disease Control and Prevention shows that's the highest weekly total since boosters were first authorized and an increase of over 15% from the previous week. Health officials, however, are still concerned about climbing infection rates ahead of the winter holiday season as colder temperatures drive people indoors and families travel to spend time together. Emergency room doctor Megan Ranney.
So I'm definitely worried about these gatherings being a source of spread of the virus. We know there are already surges across the Northeast and the North. And as an ER doc, I can tell you our hospitals are already overwhelmed.
After about 2 months of declining infections, the United States has reported daily increase for the past 2 weeks. And there are concerns the U.S. could follow a fresh outbreak in Europe. U.S. regulators expanded eligibility for vaccine booster shots to all adults, allowing millions more Americans to get additional protection at least 6 months after the second dose of the Pfizer-BioNTech or Moderna vaccines, or 2 months after receiving Johnson & Johnson's one-dose vaccine. Regulators backed the additional doses out of concerns over data showing immunity generated by the first shots wanes over time.